Hello, my name is Jill Dehlin, and I am going to be doing a Facebook Live today for the American Migraine Foundation and Move Against Migraine for you to learn more about how to be your own best patient advocate. So welcome to this Facebook Live. Again, I am Jill Dehlin. I am also a teacher and I like to work with PowerPoint. So I've got my trusty PowerPoint presentation behind me, and I am going to use my PowerPoint to help keep the presentation focused. So the purpose of this presentation is to define advocacy and describe a couple of different advocacy types. I looked advocacy up on the interwebs, and there are lots of different kinds of advocacy, but the two I'm going to focus on today are personal advocacy and group advocacy. We're also going to talk about ways to become an advocate, and then we're going to help you learn to get involved. So what is advocacy? Advocacy is the ability to speak up for yourself or others. Advocates make choices about what they want and take steps to make it happen. They are able to communicate their views and preferences and have these heard. I know many of you do this, but I know some of you, especially in the healthcare setting, find this to be somewhat difficult. So the types of advocacy that I'm going to be talking about are personal advocacy and group advocacy. If you're just joining us, I'm Jill Dehlin, and I am a registered nurse, and I'm going to be talking about advocacy and be giving you some hints. But I'd also like your participation in this talk by letting me know what you do in the healthcare setting to advocate for yourself. The goals of personal advocacy are to create change, reduce the stigma of migraine, cluster, or other diseases, and help others understand your disease. An example of personal advocacy to help other people understand your disease would be in the employment setting or among friends. And I know a couple of different people who, when they have a migraine, they just are off the map, and nobody even knows why they're missing from their lives, but they just disappear. It's really important for other people to understand why you aren't there. And to help reduce stigma, we need to help other people understand what it is that we are going through with our headache diseases. The other goal of personal advocacy is to improve communication with, as I mentioned, friends and employers, but also caregivers, family, and healthcare providers. I have a difficult time advocating for myself when I don't feel well. And what I've told my husband is if I'm laying in bed, what he can do to help me out is just bring me a glass of water. And that is really what I need for him to do. But I need to advocate for myself and ask others for help. By doing this, you are really empowering yourself to take ownership of your health care. So what can you do to advocate for yourself personally and in the healthcare setting? Again, please send me some comments and I'll do my best to address them. In the meantime, I'm going to continue on. And here we go. So here are the steps for advocacy. First of all, in a healthcare setting, it's important to advocate for yourself. And the best thing that you can do is to bring a list of any kind of medications that you have. So come prepared. Bring a list of your questions. If you don't understand the answer that you've been given, speak up. Your physician or nurse practitioner or physician assistant is not a mind reader. So you need to let them know that you don't understand. And when you finally do think you understand, repeat that answer back to make sure that your understanding is the same as their intent. The other thing, besides bringing a list of your medication, is to bring your headache diary. And I know it's difficult to always keep a headache diary, but it's really important not only to track your frequency of migraine or other kinds of headache attacks, but to also document how many of your medicines that you're using. And those medicines would include abortive meds like triptans, rescue meds like NSAIDs and other pain relievers. So bring a list of those meds. If you're really feeling too ill to advocate for yourself, bring a friend or a caregiver. And that sometimes helps as well, because when we are in the middle of a migraine attack, it's not uncommon for us to have memory deficits. I often call it the Swiss cheese brain, the migraine brain. So it's difficult to remember exactly what happened. And write things down when you visit your healthcare provider, because you may forget later. The other key when you're visiting your healthcare provider is to be polite, but also to be firm. You know, your mother always said you can catch more flies with honey than you can with vinegar, and the same is true when you visit your healthcare provider. The other thing that I've done that has really made a difference for me is to create a healthcare history. And if you excuse me for just a minute, I'm going to pull the screen a little bit closer so you can see it better. There, that's a little better. So I created a healthcare history for my mother before I became chronic. And the one for me looks like this. So on it, I have my full name, my date of birth, all the allergies that I have to medications. And this is true allergies, allergic reactions such as your face blowing up or anaphylaxis or trouble breathing. The other thing that I have on my list is adverse reactions, and this means the things that I refuse to take. For example, I refuse to take certain medications that I've had really bad reactions to. For me, I can't personally take topiramate or Keppra or opioids because I don't like the side effects that they have. So it's important for caregivers to know these things, especially if you're visiting them for the first time. You need to have on your list a name of your current physicians and their phone numbers, as well as your emergency contact person and his or her phone number. That's really important. The other thing that I have on my list is my problem list, which is unfortunately long, but I'll tell you what, when I had a cardiac event last month and I brought my little list with me, the guys in the ambulance were very grateful to have that list, and the people in the ER were very grateful to have the list. And the people who were my caregivers, once I got on the floor, were very happy that I wrote down all my list of these kinds of things. It's really important. And I update it anytime any of my medicines change. So the other thing I do is I keep a copy of it in my glove compartment. And this is really for two reasons. One reason is in case I'm in a horrible car crash, which isn't really likely, but in case I am, all of this information is right there in my glove compartment. And this is a place, excuse me, that emergency responders usually check if you are incapacitated and can't respond. Excuse me. Airplane cold. And if I'm seeing a new physician, I bring it with me to my visit. There are some other things that you should have on your list. And this is any medicines you currently take. This includes prescription, over-the-counter, and any herbal medicines, and any medicines that you take as needed. I also have my vaccination history because I can never remember when I had my last flu shot or my tetanus shot, so that's something that you can add. I also have a list of all my surgeries and dates, any illnesses or injuries that I've had, and any diagnostic procedures and their dates. I also have my family medical history. I am so sorry. I hope that's not going to continue. I'm so sorry. So now I'm going to take a look at your comments and suggestions to see what you have suggested for me. Okay. I don't really see anything yet, so I'm going to continue on and explain a topic near and dear to my heart. And this is patient-centered care. Patient-centered care is what you should expect when you go to your physician's office. And this is a type of care that did I miss one? I think I missed a slide. I thought I had a slide that said Advocacy Do's and Don'ts, and I think I skipped it. So I'm going to go back and just read it from my notes. Some of the things that you shouldn't do when you're advocating for yourself in the medical care setting is don't bring a stack of articles from the internet and expect that your physician is going to read them and be able to apply them to your care. If you do bring documentation from the internet, make sure it's from a reputable source, such as a peer-reviewed journal or an article that's from the National Institutes for Health or an educational website. So you can usually tell the better websites if they have a .org, .edu, or .gov after their web address. So that's the other thing I wanted to say. But back to patient-centered care. What is patient-centered care? Patient-centered care values the patients for their contributions to the care plan. After all, back in the old paternal model of healthcare, patients were given their marching orders in a very paternalistic way, and they were expected to do what the doctors told them to do. What we're shifting to, and hopefully your physician or other healthcare provider has shifted to, is a more patient-centered approach. And this is really a collaboration between you and your physician. And it depends on not only on collaboration, but on shared decision making. And that means that your healthcare provider should be talking to you about what he or she recommends and then giving you options, and then having a discussion in the doctor's office about what you think is best with regard to your own personal situation, your financial situation, your culture, your family situation. All of these things should be taken into account. So the New England Journal of Medicine says that a patient-centered approach is addresses an individual's specific health needs and desired health outcomes as the driving force behind all healthcare decisions. Patients should be partners with their healthcare providers. And providers should treat patients not only from a clinical perspective, but also from an emotional, mental, spiritual, social, cultural, and financial perspective. Patient-centered care and shared decision-making shouldn't be just the ideal, but should be expected when you go to the physician's office. And being allowed to participate in your own health care and making those decisions is very empowering. If patients and their families are more likely to follow a health plan if they understand it and they agree to it. So I'm just going to check for any other questions or comments, and I don't see any yet. So I'm going to continue on. I wanted to talk a little bit about group advocacy, because even though patient advocacy in the healthcare setting is really important, what's really empowering and has been empowering for me is group advocacy. And I am defining group advocacy as something that involves people with shared experiences, positions, or values coming together in groups to talk with each other and speak up collectively about issues that are important to them. These groups aim to influence public opinion, policy, and service. They vary in size, influence, and motive, and they're often included on planning committees and involved in commissioning health and social care services. So I wanted to use that to segue to some examples of how you can be an advocate, not just for yourself, which I've already sort of explained, but how to help others who are suffering from the same kind of condition that you might be. So how can you become an advocate? Tell others about your journey with migraine disease or other headache disorder or chronic pain disorder. Mention your disease on Facebook so that your friends understand what it is you're going through. Educate your employers, coworkers, friends, and family. Explain what it is like for you and what you have to deal with. And the other thing that you can do is post your story. One place that I've been involved with is through the National Headache Foundation, and this is headachestory.com, www.headachestory.com. It's right here. The other advocacy organizations that I can remember, that I can recommend, besides Move Against Migraine and the American Migraine Foundation, is the 50-State Network. And the 50-State Network is something that you can do and sign up for. You will get a personal call from a representative from the 50-State Network. And their goal is to have people from all over the country to participate as advocates when situations arise. And it's not just people with headache disorders and diseases. They're also trying to get people with other chronic illnesses. The other one is the Alliance for Headache Disorders Advocacy, and their advocacy effort is called Headache on the Hill. Here's a screenshot of the 50-State Network, and their web address is www.50statenetwork.org. And all you have to do is click on Become an Advocate and apply for that. It's a great way to get your feet wet as an advocate. The last thing I want to talk about is Headache on the Hill. And Headache on the Hill is sponsored by the Alliance for Headache Disorders Advocacy. And this is a group of patients, caregivers, and physicians who go to Washington, D.C. every year about February, middle of February. And the reason they go in February to DC isn't because of the great weather, because it's a little iffy in February, but because that is right before the decision makers make their decisions about budget considerations. So this is why Headache on the Hill is scheduled for that time. Headache on the Hill has grown from a small group of physicians, neurologists, and caregivers, and patients to over 150 people who march on Washington. And it's not like we have a big march and protest. It's more like we meet, learn how to be advocates, learn how to interact with our representatives and senators. And then we are given a group of about 4 people that we move together with and visit our individual senators from our own states, and then the representatives from the states that we are from. For example, when I've done Headache on the Hill, I am matched with 4 or 5 other people. One is usually a physician or a neurologist or a headache specialist, and the others are people who have migraine or cluster. And we go to the offices. We have appointments that have already been set up for us, and we visit those individuals or their staff members. And we have a particular thing that we are asking for. It's called an ask. And we go in, tell them their stories, and ask for this particular consideration. I have to tell you that participating on Headache on the Hill is one of the most empowering things I've ever done in my life for myself, because I didn't just do it for myself. I did it for other people who are also experiencing problems with headache, migraine, and cluster disease. So that is about it.